A therapy or medical treatment is the attempted remediation of a health problem, usually following a medical diagnosis. As a rule, each therapy has indications and contraindications. There are many different types of therapy. Not all therapies are effective. Many therapies can produce unwanted adverse effects. Treatment and therapy are generally considered synonyms, however. In the context of mental health, the term therapy may refer specifically to psychotherapy. The words care, therapy, treatment, and intervention overlap in a semantic field, and thus they can be synonymous depending on context. Moving rightward through that order, the quantitative level of holism decreases and the level of specificity, although it sometimes implies a narrower idea. At the extreme, the piling on of such countable interventions amounts to interventionism, a flawed model of care lacking holistic circumspection, merely treating discrete problems rather than maintaining health. Therapy and treatment, in the middle of the semantic field, can connote either the holism of care or the discreteness of intervention, with context conveying the intent in each use. Accordingly, they can be used in both non-count and count senses. The words aseology and iametology are obscure and obsolete synonyms referring to the study of therapies. The English word therapy comes via Latin therapia from Greek therapeia and literally means curing or healing. Levels of care classify healthcare into categories of chronology, priority, or intensity, as follows. Treatment decisions often follow formal or informal algorithmic guidelines. Treatment options can often be ranked or prioritized into lines of therapy. First-line therapy, second-line therapy, third-line therapy, and so on. First-line therapy chosen based on the clinical experience of the physician. If a first-line therapy either fails to resolve the issue or produces intolerable side effects, additional therapies may be substituted or added to the treatment regimen, followed by third-line therapies, and so on. An example of a context in which the formalization of treatment algorithms and the ranking of lines of therapy is very extensive as chemotherapy regimens, because of the great difficulty in successfully treating some forms of cancer. One line after another may be tried. In oncology, the count of therapy lines may reach 10 or even 20. Often multiple therapies may be tried simultaneously. Thus combination chemotherapy is also called polychemotherapy, whereas chemotherapy with one agent at a time is called single-agent therapy or monotherapy. Adjuvant therapy is therapy given in addition to the primary, main, or initial treatment, but simultaneously. Neoadjuvant therapy is therapy that is begun before the main therapy. Thus one can consider surgical excision of a tumor as the first-line therapy for a certain type and stage of cancer, even though radiotherapy is used before it. The radiotherapy is neoadjuvant. Premedication is conceptually not far from this, but the words are not interchangeable. Cytotoxic drugs to put a tumor on the ropes before surgery delivers the knockout punch are called neoadjuvant chemotherapy, not premedication, whereas things like anesthetics or prophylactic antibiotics before dental surgery are called premedication. Step therapy or stepladder therapy is a specific type of prioritization by lines of therapy. It is controversial in American healthcare because unlike conventional decision-making about what constitutes first-line, second-line, and third-line therapy, which in the US reflects safety and efficacy first and cost only according to the patient's wishes, step therapy attempts to mix cost containment by someone other than the patient into the algorithm. Therapy freedom and the negotiation between individual and group rights are involved. Treatments can be classified according to the method of treatment.